Hey there, how are you? I hope you're doing well. Just wanted to give a quick little update about my medical stuff. Last video we talked about my new diagnosis and kind of what was going on with that, with the polycythemia and that sort of thing. I should clarify secondary polycythemia. That showed up in my diagnoses and my medical records here recently after some blood tests and that sort of thing. After that happened, I also, and mostly because of my blood pressure being what it was, I went in and saw my cardiologist, who did some checks on me, got some blood work, did that sort of thing. Also, gave me a prescription for amlodipine, which is a vasodilator, because of my underlying condition of granulomatosis with polyangiitis. That underlying disease causes my blood vessels to constrict quite a bit, and the amlodipine will help alleviate that. So we managed to bring my blood pressure down considerably. We're still working on it, tweaking little things here and there. We added 5 milligrams of lisinopril just to again try to get the diastolic number down. It's doing my numbers overall have been doing really well at 120 or 125 over, but it's that over number that's like 90 or 100 sometimes. So, but that was much better than like 168 over 155 that I was dealing with earlier this month. So we're definitely headed in the right direction as far as that's concerned. So I'm super stoked about that. During that appointment where he prescribed the amlodipine and that sort of thing, he also asked for a CT scan of my abdominal region, specifically my kidneys and the arteries going to them. I got that done yesterday, and it was actually kind of a cool experience because I got to help another student. I actually really enjoy working with students in the medical field, just because I've been doing it for so long, and I get to interact and actually help them learn things. And I dig that. So, and that's totally ego. I'm aware of that. Anyway, they managed to actually have the results in my dashboard before I even got home, which shocked me, if I'm being completely honest. So the CT scan was looking basically to see if I had stenosis in the arteries, which is again that where the arteries kind of clamp down and they don't allow as much blood flow to go through. The results show no evidence of renal artery stenosis. So that's good for a couple of different reasons. One, I don't have stenosis. Yay. But the other thing means if I'd had stenosis while even still being on the vasodilators, it means they'd have to go in and put stents in, much like heart patients have to do after like a big heart attack or too much buildup in their arteries, that sort of thing. They would have to go in surgically and put those stents in. However, because I don't have stenosis, I don't have to worry about that. Because there's a bunch of other stuff that would have to go on behind the scenes that wouldn't be tragic. It would be uncomfortable, unpleasant, and kind of an inconvenience. Because of the blood thinners I'm on, I'd have to go off of those for a while to go through the surgery, and then coming back, I'd have to be on a bridge to get me back, to get my INR back to where it needs to be to go back on the blood thinners. Which the bridge is it's an injectable that I do myself. I've done it. It's fine. It's no different than doing like an insulin injection for a diabetic. It's the same process overall. So anyway, point of all that was no arterial stenosis in my kidneys. That's great. That means, however, that there's likely something going on inside my kidneys that is causing the issue. I don't know that for sure. That is based on what I talked to my cardiologist about and my experience with all of this over the last 8 years. There's something going on in my kidneys probably causing this issue. So now I'm waiting to hear back from my nephrologist to see what he wants to do for next steps. In fact, even my cardiologist who ordered all of these tests said we were going to wait. We were going to wait for nephrology to get back to us on what next steps were in that regard. However, so all that was honestly was good news, right? Like no stenosis, no intrusive surgeries of any kind, no going off the blood thinners and then the bridging and then back on the blood thinners. Don't have to do any of that, and that's great. But it does mean that likely I'll have to go on some different meds to help my kidneys compensate for whatever they're doing inside me. But they also did some other stuff while they were looking. They found some other stuff while they were looking through through my through my abdomen through the CT scan. What I didn't notice, and I wish I'd taken a picture of it, is the camera above that keeps track of the patient going in and out, that sort of thing, is actually done with a Microsoft Kinect camera, which I thought was hilarious. I know it's not a new thing. I know that it's widely known by a lot of people, but I find it amusing every time I have to go in for one of these. So let's do this. I don't think there's anything in here that matters. I mean, I'll blur a couple of things out. I'll blur a couple of things out. Single renal arteries identified bilaterally. No evidence of renal artery stenosis. Yay. Atrophied kidneys bilaterally with cortical thinning. I've got kidney disease. That doesn't surprise me at all. It just that my kidneys suck, and that's one of the side effects of it. So nothing big there. Single renal arteries identified bilaterally. No evidence of stenosis in either artery. Kidneys are atrophic with areas of cortical thinning. The kidneys enhance symmetrically. No evidence of stone or hydronephrosis or hydronephrosis. Geez, I'll get it out here one of these days. It is what it is, right? Not a big deal. The visualized portions of the liver show normal enhancement, no evidence of duct dilation or focal lesion. Portal vein is patent. Liver's good, yay, which surprises me after my 20s. Lobulated appearance to the spleen with areas of calcification. Recommend correlation with regard to prior trauma or infarction. So basically my kidneys are being, or not my kidneys, well, my kidneys too, but my spleen is calcifying a little bit. Pancreas normal in size, no evidence of duct dilation, enhances normally. Yay, my pancreas is good. Abdominal aorta normal in size, no evidence of significant or atherosclerotic disease. Celiac arteries, superior mesenteric arteries are unremarkable. Inferior mesenteric arteries unremarkable. Good, nothing going on there. Adrenal glands are unremarkable. Doesn't surprise me. They get a good workout. Small bowel is grossly unremarkable. I found that amusing, that my small bowel is grossly unremarkable, and no evidence of distension. Colon is unremarkable. However, I can't scroll down any further. Degenerative disc disease in L2 and L3 with minimal retrolesthesis on L2 and L3, and we've got a surgical staple because I had some stuff done for what's that called? Peritoneal dialysis. Back in like late 2016, early 2017. So there it is. That's kind of my update as far as what I know. Again, I'm still waiting to hear from nephrology about what they want to do with regards to all of the kidney stuff. I'm also going to reach out to my primary care physician with regards to the spleen thing, as well as the L2, L3 issue. But that's it. Of course, they went in to look for one thing and they didn't find it, which was great. But of course, then they found two more things. So that just seems to be how it goes for me with regards to my medical stuff. At this point, I'm not even mad about it. Like, I find it amusing that they're like, hey, we're going to go look for this. We didn't find it, but here's some other stuff to add to your list. So again, still waiting to hear more details about some of this stuff. Like I said, cardiology is referring most of this to nephrology. Since that is, kidneys are their specialty. That's literally what they do. So that's it. That's the update I've got. Comments, questions, whatever, leave those in the appropriate place wherever you find this. And I'm gonna go probably clean up a little bit this fucking camera, randomly pull in focus. Never mind that I've got facial recognition on this camera. Anyway, so with all that said, I'm going to go ahead and wrap this up. I'm going to go make myself look at least a little better, and then I'm going to get a video knocked out for the main channel. So again, thank you so much for your time, your support, that sort of thing, and I'll talk to you in the next video.